Well, we know that Ozempic has helped many people in losing weight, but can the drug help with curbing alcohol consumption? The company being the way that makes that weight loss drug is now starting a new clinical trial. Joining us to talk about our health headlines, he is Dr. Bill Hartman, the clinical trialist at UW Health. Doctor, great to see you. This is a very interesting clinical trial. What are they looking at here?
So it's a little bit obscure. What they're looking at is going to be how their drug Ozempic may affect the overall health and function of the liver. But as a secondary endpoint of this study, they're going to ask people the question about their drinking habits and to see whether or not their consumption of alcohol goes down as they use the drug Ozempic or its partner Wegovy. The study really stems from the fact that thousands of people have said that as they take Ozempic, their drive to drink alcohol has really decreased. But to this point, we don't really have any hard evidence that that's actually the case.
It's pretty wild. I mean, people are saying, yeah, I'm losing weight, but suddenly I don't want to pick up a beer anymore. Some people even saying, I don't want to pick up my vape pen.
Right, and not that I totally understand how it suppresses the drive for all of these things, but it definitely is having a lot of beneficial effects in your overall health. We're seeing things like hypertension decrease. Obviously, you see things like weight decrease. In a few years, I'm sure that we'll see that the use of these drugs is going to increase the overall health and likely the overall lifespan of people that are using them.
And this is grabbing so many headlines because when you think of something like alcoholism, it tears so many families apart. It destroys so many lives here. But sadly, there's not a lot of research being done to cure various addictions. I was reading for drug companies, it's just not been a moneymaker. And sadly, that means they're not putting money into these kinds of research.
Right. That's one of the big downfalls of having big pharma kind of dictate how our medicines are going to be made and the direction we go. In addiction, which is a huge problem here in the United States and worldwide. But with addiction medicine, we don't really have any good medical therapies. So studying a drug like Ozempic to see whether or not it has the beneficial effect of decreasing someone's drive to drink or decrease someone's drive to do other drugs, this is really a step in the right direction and hopefully can give us some answers and a tool to use for people who battle addictions.
Yeah, it's so interesting. Another topic I want to touch upon, and this comes from someone who just ate a giant pile of bacon over the weekend. There are new studies that says maybe we should give up that meat.
So in this particular study published in PLOS ONE this week, they looked at 50 different studies based on diet from the year 2000 to the year 2023. And what these showed was that people who used a plant-based diet had significant reductions in both the incidence of cancer and heart disease, probably because you're increasing the number of anti-inflammatories, the number of vitamins, a lot of the good things that help keep your cells safe and your organs safe and free of cancer.
I'm going to share this with my wife because she was the one who told me to get the side of bacon at her Mother's Day brunch. Dr. Bill Hartman from UW Health. Appreciate your time.
Thank you.